Hey guys, it's Dr. Emer. We're at the end of the day, and we are now doing Michael's acne scar treatment. We are using the Fraxel 1550 wavelength. This is the deeper wavelength for scars. We'll work later on his superficial texture by either doing a 1927 and a follow-up in a month, or a peel or something more light. Are you feeling this?
Oh no.
So you're not really feeling it much.
No.
That's good, because we did the nerve blocks. Now, the 1550 is a different wavelength than the 1927. This one goes much deeper in the system. So instead of going about 200 or 300 microns, this is going about 1300 to 1500 microns, which is much deeper, and this is why we're doing this treatment for him for his scars. And you can combine this with more superficial things. Perfect. Turn this way, that's half the forehead. Is anyone asking any questions? The thing about fractional lasers is that you see the surface doesn't get burned. You can see the little dots here. Take a look if you zoom on in here. These are the fractional columns. We call these the microthermal zones. Those little zones are where the heat is being delivered deeply through the skin, and where the epidermal necrotic debris or the damaged laser zones will exfoliate over the next 3 to 5 days. That's why post-treatment it's extremely important to do enzymatic exfoliation, masks, and peels. You see, as we do more passes, the little dots become closer and closer together. That's because that's the density, the high density that we're doing there. Now, Michael's done a bunch of treatments, such as peels, CO2 laser, fillers, subcision. Michael, what do you want to tell people about getting treatments done? What are your expectations?
I think what people need to understand is that fixing scars doesn't happen overnight. I've been treating myself for 5 years, and treating your scars it's like going to the gym. If you want muscles, you got to work at them.
That's true. So unfortunately, I mean, I wish I could turn all the weeks into. You can see where he has a significant amount of scarring. I wish, honestly, I know people get upset sometimes when they come in and I tell them they need lifelong treatments, or if they, they ask me, how everything is so expensive and stuff, and I tell them I wish it could be different. I wish I could in one treatment cure everything. I love what I do, but unfortunately, this is kind of the road we've been dealt with and we have to work with. It's the best treatment options we have. And when people come to see me, I give them the best options, and I tell them we will try and customize everything we can to try and get them the best outcome in treatments. But if you don't do treatments consistently, you're not going to get a result. How is the pain there?
It's very minimal.
So he did the nerve blocks. Is anyone saying anything?
One sec.
So you guys can see as we roll across, this is called optical scanning. The laser only delivers energy as it's being scanned across the system, across the skin. And each time the energy is delivered evenly and equally, homogenously. No company, because this is patented technology, has been able to replicate. Non-ablative fractional laser is the Fraxel, and there's no other gold standard. And you can see as we roll, you see more of these dots are overlapping.
How many passes are you going to do in each treatment area?
On average, 6 to 8. We watch the skin. He's doing really well. I'm going to go probably 8. The number of passes determines the density. What matters is the energy when it comes to scars. The higher the energy, the deeper the laser is going. We're at a max energy here today for him at 70 millijoules, which goes about 1,400 microns or so. This allows us to get really relatively deep in those scar areas and promote a lot of collagen long term. You don't need that level when you're just doing rejuvenation. This is more for scars and people that have had burns. He's doing quite fantastic, guys, because we did the nerve blocks and he did the topical for a long time. Now at this point, if you didn't have nerve blocks, usually the energy, the heat is building up. And so the key will be right when I'm done with this side, another pass or so, we're going to give him ice packs. And he's going to hold those on there. Even if he doesn't feel them, we want him to use them, push this up a little closer to the eye, because we want the swelling to go down pretty quickly.
Is this non-ablative?
Yes,
Yeah.
so non-ablative means no, last pass, turn to the left. Turn to the left. No, non-ablative means no char. So you see how when we're rolling laser across the surface, you only see those little dots? That's deep heating. That's non-ablative. Fractional means little dots rather than all the surface being damaged at once. So what is the expectation, Michael? What do you want to tell people your expectation should be to look like in the next couple days? You give him the ice pack really quick to hold on his right side. Hold on, I'm going to give you that.
So you can expect to be
Right here. Turn all the way to the right now. There you
you can
go.
expect to be
A little
red
bit more.
and
Good.
hold on.
Wait, where are you going? Stay down.
I was just like choking.
Oh, okay, stay down. Okay, we're now starting
Yeah,
on the
you
left
can
side.
just expect to be red for 5 to 7 days.
Right, but how do you tell the difference between an ablative or a non-ablative? What do you describe it as?
So ablative consists of burns to the skin.
Yeah, so what would you say someone would have on their skin after an ablative?
You can expect peeling.
Yeah, scabs.
Yeah, scabs.
And in a non-ablative, it's just redness like a sunburn. So there's no scabs, there's just flaking. Can you wipe his mouth for me for a second, guys?
Yes.
It's normal with the nerve blocks. You're doing great. Nerve blocks are good, huh?
Yeah.
Were the nerve blocks really painful or no?
It just burned for a second, but that's all.
That's great. So yeah, tell them more. So 3 to 5 days, and then what are they going to want to do afterwards?
So afterwards, you're gonna want to follow the protocol of using skincare. It's very important that you follow the protocol for recovery and healing. You're gonna want to use vitamin C, vitamin B. You're gonna want to use sunblock if you're gonna be out, but I don't recommend going out. If you're gonna go out, wear a hat, wear plenty of sunblock every 2 hours as long as you're in the sunlight.
Good. And then we also use some iodine-like ointments. I tell people no heavy ointments or creams. We're using Dermal Repair by Sente. We're using a vitamin C and B combination.
You can also use stem cells by anti-age.
Anti-age stem cell, EMK stem cells, and masks. At-home cooling masks are really important. And then we use enzymatic exfoliation, papaya enzyme, charcoal or pumpkin to help lift the skin, exfoliation. You can see, guys, now we're getting to a density where you see more of those little dots coming together. So you see those all starting to come together.
Would you recommend vinegar soap?
Not for this. You don't need, anytime you have scabs is fine, but for non-ablative, it's not necessary. Now, if people have had acne before, I would treat them with an antibiotic right now. If they have a history of cold sores, I also would treat them with cold sore medicine. Just preventative, because those things can sometimes pop out after a laser treatment. Any other questions, you guys? Anything people are saying over there?
They love it.
He's doing great. He's your guys' ambassador. He wants to be educating you and teaching you. Our goal is, over the next few months, he gets some treatments done that you guys can learn from.
Yeah, it's not bad. Not bad at all.
What?
The pain.
Yeah, you're almost done. Actually, basically done. So this is to show you guys that Fraxel is not as bad as people think. There's a lot of ways to make this very comfortable. And again, gold standard treatment. Last pass. If you want the skin to heal more quickly, we could do PRP, stem cell therapy even daily. You can do oxygen facials, LED at home, etc. All right, so go ahead and take that away. I'm gonna do your nose, and I'm gonna put ice packs on you and a mask. But I want everyone to see, you can see the dots really well when you do the nose. So if you guys take a look at the nose, you can see the fractional columns. Every one of these little dots is a little injury into the skin. We call it a microthermal zone, where the skin will exfoliate, and that will help him heal, and that's the science of non-ablative. Okay? What I like also about doing this on the nose, especially for people with sebaceous hyperplasia or rosacea, they get a decreased oil production, decreased pore production, shrinking in the nose size, as the nose grows with something called rhinophyma as people age. And that's it. Being thorough, very thorough, just making sure all the nose is covered. Beautiful. So let's take a final look. Okay, take this away. Let's take a final look. Let's give him the Zimmer cooler. Go ahead and take this cooler in your hand. Blow that on your skin, because we want to decrease the swelling almost immediately. Now, I'm going to point everything out. So basically, look, no bleeding, no petechiae, no bruising. All you see are the dermal and epidermal columns, the microthermal zones. Every one of these is going to swell up and exfoliate from underneath, building collagen over time. That's the science of fractional technology. This is the Fraxel Dual 1550 treatment. Again, in my opinion, even after 10, 15 years, people have been trying to copy this patent, and it's almost impossible. No one's been able to do it. This is the gold standard treatment for non-ablative fractional resurfacing. Here, treating Michael, who's had severe acne scars, had to be on Accutane, terrible acne, multiple laser treatments. Now we're going to his maintenance treatment of non-ablative lasers. He's going to show you what he's going to be looking like over the next week or two. It's going to be phenomenal, so stay tuned for that. Thanks, guys.